In my role as deputy chief, I'm always running into multiple people throughout the department and outside of the department. And there's so many different questions that are coming from our police officers that are unanswered. And myself, I was confused about COVID-19. What should I be doing to protect myself from COVID-19? Well, fortunately, I'm a big believer in the community, in partnerships, and in collaboration. Well, I had a great partner living right next door to me, Dr. Manya Gupta from Rush Hospital.
My name is Dr. Manya Gupta. I'm a hospitalist at Rush University Medical Center, so I'm an internal medicine doctor for people who are admitted to the hospital. And my group and I have been doing these officer roll calls for the last couple of weeks, and it's been just an awesome experience for us. My next door neighbor happens to be Mr. Ernest Cato, who is one of our deputy chiefs for the police department, and he asked me a few weeks ago if I'd be willing to get some of my colleagues and I to talk to his officers about the new coronavirus and how they can stay safe on the job and just kind of reduce fears and anxieties about the virus. And I thought, what a great way to, start a collaboration between doctors and our fellow first responders who are the police officers. And if we can help them feel more comfortable and less anxious about doing their jobs properly, then what a great opportunity for us.
The most common question we get asked is a question I think everyone, all of society is asking: what if I get infected with this virus? And if I do get infected with this virus, how do I stop from bringing it home? And that's a concern that officers have because they are on the front line. They are out there with the public, with those who having groups that don't care about this virus or taking it serious, and officers are called to be there.
Because right now officers, they're confused. They're not sure what they should do or how they should react with this pandemic. Now, Dr. Gupta can give me a list of things to say. The department can provide me with a list of things to say. But will it be as effective than coming from a professional? A doctor who have seen patients at their worst, but also who have also seen them survive. A doctor who have seen them come out of this situation and continue to have healthy lives. That's the perfect person that we needed. Those are the doctors that we needed to come here to the Chicago Police Department and tell those stories. And they've been doing it. And just to watch the officers in these roll calls ask their concerns and then get the answers. The responses that the doctors were getting out of these officers were amazing.
We've had a lot of officers actually ask about whether they should take certain nutritional supplements or eat certain things in their diet to help protect themselves or to boost their immunity. And we certainly would always recommend, simple, basic self-care types of things like sleeping enough, eating healthy, food, fruits and vegetables. People can take a multivitamin if they wish. Unfortunately, there's no specific vitamin or concoction that most doctors are aware of that is a surefire way to prevent yourself from getting the virus. If you want to focus on more evidence-based ways that you can prevent yourself from getting infected, those things would be things like wearing a mask and washing your hands and sanitizing frequently touched surfaces. If I'm wearing a mask and you're wearing a mask and I'm speaking, the chances, if I'm infected, of giving it to you are extremely small if we're both wearing masks, and especially if we're 6 feet apart. I think a lot of times with any type of illness, especially, most of us have never lived through something like a pandemic before, so it's very easy to focus on all of the negative aspects of this disease process. It's true that there are many thousands of people who have died from this virus, not only in this country but around the world. And it's possible that many more thousands will still die from this virus. But I think it's still important to remember that the vast majority of people who get this virus recover at home. And even those people who unfortunately become sick enough to get admitted to the hospital or even to the ICU, the majority of even those people still survive.
Like many things, it all comes down to communication. Talk about and communicate with others what you're going through. Share that experience with one another. And by all means, if you need a peer support member or a counselor, the EAP, we are still providing our services to our officers, either by telehealth, or if need be, we are still seeing some officers in person that may need that as well.
Well, as a chaplain, I always recommend prayer. I always recommend that sitting down, and maybe in other circles they'll call it mindfulness, self-centering. To take that moment to stop the mind, stop all these thoughts from becoming you.
How did it come about? It came about by involving our community. It came about talking to our neighbors. This would have never happened if I didn't say hello to my neighbor. This would have never happened if our neighbor didn't care enough about not only the city, about her own home, about her own practice. She cared enough about first responders. Not only Chicago Police Department, but all first responders, nurses, doctors, firemen. This is something that we have to get back to. We have to realize this isn't just a city. This is a community. This is a community with multiple resources, not just police, fire, doctors. We have garbage, people who pick up garbage. We have folks who work in hotels. We have individuals who fix potholes in streets. We have to start drawing our resources to help everyone. And this is an example of it. Now, should I say this didn't cost the city anything? No. Dr. Cooper and her staff used their personal time. And once we start doing this collectively, not only as a city, but as a nation, things will become better.